People know what they want. They want the care they need from a doctor that they choose at lower costs. That is essentially impossible with Obamacare. We have a program in this country passed only by Democrats that is costly, that is complicated, and ladies and gentlemen, it is now collapsing. And all you need to do is turn to the Philadelphia newspaper today, or any headline around the country. Here we go. Philadelphia Inquirer today. Obamacare enrollment, fewer choices, higher prices as sign-up time opens. Today. Sign-up time started today. And in Pennsylvania, the rates are up, approved by the insurance commissioner, 46%. So the headlines in Pennsylvania talk about hefty increases, bombshell prices, all of the things that people are being hit with. And if you go to the Obamacare exchange today in southeast Pennsylvania, the so-called marketplace has only one choice. Ladies and gentlemen, this isn't a marketplace that the president promised. This is a monopoly. And what does Hillary Clinton say about this? Her solution is more Obamacare. What does Bill Clinton say about this? The craziest thing I ever saw. What do Hillary's advisors have to say? The solution is more Obamacare. Can you believe it? This is what they said last week on television. Higher penalties for people under the mandate. Make them buy it. Raise taxes, bail out the insurance companies. That is their solution. Pay hospitals and doctors less when doctors don't want to take care of patients on Obamacare anyway. So that's what the advisors say. Let me just say this. What we know is that for people who believe that government is the answer, this is their solution. But I believe what Ronald Reagan believed, which is government isn't the solution, government is the problem. Republicans are here today with solutions and relief. Relief for those that have been harmed by the president's health care law, and solutions that will help people get the care they need from a doctor they choose at lower cost, because they are patient-based solutions based on freedom, flexibility, choice of individuals. And I will tell you, if Hillary Clinton is president of the United States, we will never get there. And that's why all of us are here today with you. And I'm so delighted to be joined by another physician who will introduce other members of the House, but he is a Republican House member from Georgia, Dr. Tom Price.
Hillary Clinton to make My name's Tom Price. I represent the 6th District of Georgia, which is northern suburban Atlanta. As John said, I'm also an orthopedic surgeon, so you're getting the surgeons out of the way first here. But we've got some docs here, nurses, and other members of the Doc Caucus in the House of Representatives here to tell you that you are so pivotal and vital to this victory that's going to occur in this state and in this nation in 7 days. And that's because the American people understand what's going on. So many folks across this land are opening up their envelopes today in the mail, and they see that their premiums have gone up 25%, 65%. In Arizona, it's 116% on average. Folks, this is lunacy. This is lunacy. This is what happens when you put the government in charge. The things that we all believe about health care, we want a system that's affordable for everybody, that's accessible for everybody, that's of the highest quality, and provides choices for patients. All of those things have been destroyed by Obamacare, which is why we need Donald Trump and Mike Pence to work with us to get solution exists. We've been working on that solution for years, literally. And we're so excited by the enthusiasm and the message that Donald Trump and Mike Pence have brought to the stage about health care. I'm joined, as I said, by a number of my colleagues, another physician in the House of Representatives who's going to help make certain that we take back this country to make America great again. Mike Burgess from the great state of Texas.
Well, I do love Texas, but you know what? I love Pennsylvania too. The great thing is Philadelphia, because you guys are what are going to make it happen. You see, collected on the stage here, a number of members of Congress, many of us have expertise, time and service. We are chomping at the bit to develop the policy that will then go down to the other end of Pennsylvania Avenue and be signed into law by President Trump that will end Obamacare. Many of us watched in horror in 2009 and 2010 as no Republicans were consulted and this thing was ran through. Remember, Rahm Emanuel said, never let a good crisis go to waste. Well, they certainly didn't. But the result is they gave us a new crisis, and that crisis is called Obamacare. Texas, the number of insurers have dropped, have dwindled. That's no choice at all. There are plenty of things that could be in place and could be in place in a very short period of time. Look, 20 years ago, Newt Gingrich gave us a new market-based tool that now is known as the health savings account. Donald Trump has embraced health savings accounts. I'm a believer in health savings accounts. I had one for 20 years. That is market power delivered to the patient to participate in their decisions and make the right choices for them and their family. Obamacare completely collapses that and says, you don't know enough, so we're going to tell you what you have to buy, and oh, by the way, we're going to tell you have to buy it. Hillary Clinton wants to double down on that. And just stop and think for a minute. She wants more money in the subsidies. When did more federal money going into anything ever result in a cheaper price to the consumer?
Never.
Take housing, take education. It never works out the way they tell you it will. America's ready for a change. I'm ready to step up and make that change happen. I hope you are too. I hope you're talking to your family and your neighbors, because you all are critical to make this happen. God bless you and make America great again. Surgeons couldn't work without an anesthesiologist, so we're happy to welcome to the podium Andy Harris from Maryland.
Mason-Dixon line, South New York. It also includes beautiful Eastern Shore of Maryland. And I guess Maryland is luckier because our rate increase is only 25%. That's unbelievable. But it's worse than that. I have a rural district, and the co-op, which Obamacare funded, it gave $20 million loan to, they're about to go out of business, leaving my constituents on the Eastern Shore of Maryland with one choice. That's not a choice. We were told famously, if you like your doctor, you keep your doctor. Not true. You like your plan, you keep your plan. Well, there's only one in parts of my district now. And don't worry, if you're a family, your premiums are going to go down $2,500. None of it true. This list is unbelievable what's going on. I'm going to be in the operating room tomorrow. I'm tired of hearing patients complain about what they've got to do. I'm tired of hearing my fellow physicians complaining about what Obamacare and what the federal government, through its control of the healthcare system, is doing to them. Those of you who are seniors know out there how hard it is to find a doctor who will take care of a Medicare patient now. You know it. It's going to get worse. The only solution is Trump Pence. Congresswoman Renee Elmers from North Carolina.
I don't believe this for a minute. I'm looking out in this audience across this room, and I'm seeing plenty of women. Amazing. Well, I am from North Carolina. My district is the 2nd district. I represent everywhere from the Raleigh area to the Cary area down to Fort Bragg and Fayetteville, North Carolina, where we take care of our veterans. I'm not a politician. I ran for office. While these guys back here were all fighting to keep Obamacare from affecting you, I ended up running because it ended up going forward because of Barack Obama and all the Democrats that were in Congress at the time. We've got to defeat this. You know, President Obama, said recently that, we got to keep this thing going because it's like a house. It's like a starter home. Well, you know what? If it's a house, it's an outhouse. It is President Obama. That's not the house we want to live in. And I will tell you, we need to defeat this thing. In North Carolina, our prices are going up 25 to 40%. We now have only one insurer in 96 of our 100 counties. That's single payer system if I've ever heard it. And yes, Hillary Clinton only wants to make it worse. Even if you don't have an Obamacare plan, you're being affected by Obamacare. How many of you been to the doctor recently and you felt like the person taking care of you, the nurse, the doctor, the other healthcare, was at a computer with their face in the computer longer than taking care of you? That's Obamacare. That's the effect of Obamacare. So we are all here to support Donald Trump and Mike Pence because we know they are the answer and they are going to make America healthy again. I'd like to introduce to you another fine doctor from the House of Representatives, Mr. Scott DeJarlais from the great state of Tennessee.
Tennessee has been hit especially hard. We're looking at 65% premium increases next year. How many out there have seen their deductibles go down? How many have seen their premiums go down? That's what the president told you. I got a message for Barack Obama and Hillary Clinton. Obamacare is going to fail, period. Right? It's so important right now. We're fired up, and we should be, because we got two great speakers and candidates coming up in Mr. Trump and Mr. Pence. But honestly, we're at a crossroads in healthcare. When I ran in 2010, we ran on the message that Obamacare was going to be a funnel into socialized medicine, and boy, were we right. Yep. So it's time to change this, and I can't think of a better audience to get our message out, in a better place in Pennsylvania. We need you so bad. Pennsylvania's got to come out for Trump and Pence, and we're excited for it to be here. We're excited to be with you. We have a great member of the House of Representatives that unfortunately is retiring this year. We're going to miss her dearly, but we're so glad she's up here tonight, or today. She's a great inspiration to all of us. Representative Cynthia Lummis from the great state of Wyoming.
Like so many of you, I'm a healthcare consumer, and I'm on Obamacare. And like so many of you, in fact, 4 out of 5 Americans during the last 8 years have had zero economic growth in their personal lives. How many of you can relate to that? Zero economic growth in your personal life, your family. And yet Obamacare continues to eat away at our pocketbooks. And think about the people that are going to enroll today, that are going to see these 25, 46, 116% increases. After 8 years of their pocketbooks seeing no change, when Americans don't participate, when they are not needed, when the government tells the American people, this is how you're going to live your life, this is how you're going to choose your doctor, Americans get angry.
That's right.
That's right. We are angry.
Don't get angry. Get Trump, Pence. Get Trump, Pence.
Hey guys, I will be back live when Donald Trump is on stage, okay? Tune in.